It is a skincare issue that can be as debilitating as it is embarrassing. And so here with tips and treatment options for rosacea is JoAnn Francis, a licensed clinical skin specialist. April is Rosacea Awareness Month, and I was interested to learn 16 million Americans suffer from this.
Yes, and both men and women. Now, it is not known what causes rosacea, and even though we don't really know the cure for rosacea either, but the appearance of rosacea can be managed.
Wow. Real quickly, before you go on, I know that we have a couple of pictures of examples.
Exactly.
And one of the things you were saying, it can go from mild to severe.
Yeah, and a mild rosacea could be anywhere from flushing or a rosy look, but also to severe acne rosacea. And the appearance can be managed. It can be managed with prescriptions. It can be managed with IPL photofacial, professional products, and lasers.
Normally you see this at what age? This is past?
It usually starts around the age 30 or 40.
Okay, okay.
Yes.
So common triggers, since there's not a cure, there are some triggers that can maybe help you if you can identify those.
Exactly, and that's what I brought today, because a lot of people will say whether they know they have it or not, sometimes it's there, sometimes it isn't. So triggers such as sun exposure. Sun exposure is inflammation, it's heat, it's UV radiation, will flare up. So when you're doing a sunscreen, you want to try to stay away from chemicals, and you want to try to have it to be oil-free.
Got it, oil-free,
and that'll help
very
the
important.
inflammation.
Sure, next.
We have our alcoholic beverages. This is a trigger. Now, honey, I do suffer from rosacea, but I'm still going to have my glass of wine with my husband James on the weekends.
At least you're honest, yeah.
With dinner, but I do keep it managed, but I'm still going to indulge.
Okay, I see something spicy right there.
Yeah, spicy foods, and we do like flavor, but I try not to make it too spicy because it depends on what I'm doing the next day, whether I'm going to have a flare-up.
Gotcha, gotcha. And next?
Makeup. You want it, again, also to be oil-free. Try to have it natural if possible, but it's the fragrances in it, it's the oils in it. But then you're going to see a can of hairspray. When you're spraying, especially for severe rosacea, be careful not to have the hairspray on the face because it has alcohol.
And it can trigger. Gotcha.
It can trigger. These are all your triggers to rosacea.
Bar soap.
You don't want to use bar soap on the face. A lot of different reasons. Bar soap is a little bit stripping of the natural lipids, and this compromises the skin barrier. So when you compromise the skin barrier, there's going to be inflammation.
Now, you mentioned on the face. What about rosacea on the body? Is that?
It's not very common. It's usually on the face, but there is ocular rosacea too, which has to be you know, with a doctor that's going to diagnose it.
And then finally, it's kind of impossible to live a stress-free life.
True.
But stress can cause flare-ups.
Stress can cause flare-ups, is why I put this funny picture here as well, as a man under stress with a very red face.
Oh,
so
wow.
It causes inflammation, just like our sun, and extreme heat and cold.
There you go, going from one
even our
temperature to the next.
skiers, yes.
Yeah, all right,
Traveling.
triggers, if we can manage those, and
definitely,
perhaps your rosacea will lessen a bit. JoAnn, nice to have you. Thank you
Pleasure
so much
to be
for
here
coming
again.
in.
Thank you, Holly.